as per se, it's like more on serving the nation and serving the people in the human community, right? And the welfare of all the people and the patients is what the major focus is on for every doctor, is what I assume out, right? So what do you think about this as a career, as a business opportunity for people? Because a lot of people are starting now towards this field.
So I think, before COVID, sales was the number one employer in the world. Second was education. Third was healthcare. So, unfortunately, because of the COVID, both education and sales have gone down. So, healthcare has become the number one employer in the world. So, it's not just by chance or whatever. It is also be by compulsion, that because healthcare will be employing a very huge number of people. I think the future employment in healthcare is opportunities are immense. The other thing is healthcare bandwagon is like it's like Indian Railways. So whatever everything takes you from A to B. So now it's a career from you not being employed to you being employed, and it takes you to a destination. Now, how do you want that journey? Healthcare has everything. So you can be at the lower end of the ladder, you can be at the higher end of the ladder, depending upon what your acumen and what you really want to achieve from your life. So you can travel first class and you can travel in general compartments. So healthcare is here to serve the needs of everybody seeking employment from healthcare.
Right. Just give me a minute. What we will do is we'll start in next 3 minutes. Let me get the technical things on right. Bhavani, can you please take us on the Facebook Live, because we have a lot of participants on the Facebook right now and on the YouTube Live. If you can put it on the Facebook Live in a minute from now. Because I think we have like around 400, 500 participants on the Facebook Live right now. Bhavani, please, can you do that? You're there? Dr. Shantanu, you are there? Do you see Dr. Shantanu here? So that's it. Maybe you can interact with people for a minute and I'll just come back. I'm just doing the technical working.
Yes, sir. Good morning, friends. So I am an insurance consultant. I'm looking health insurance topic over here. So if anybody have any questions regarding health insurance, they can come up with the questions and I'll be there to answer them. And let me know how I can help you out. So if you are not able to speak, you can put it on chat box for the question and answer.
Sir, sound nahi aa raha.
Am I audible?
I think sound is there. Right. So all the other participants now can mute yourself, and then we'll start in a minute from now. Shantanu sir, if you are there, please come online. Dr. Shantanu, I can't see you. Okay. We'll be taking the questions and all as in when we go around here. I think Nitin sir, we'll start now. It's already 11:30.
I have talked to Dr. Shantanu. He's just coming just in a half a minute or maximum 1 minute. He's coming. Some technical issue is there.
Fine. We'll wait for 60 seconds. Otherwise, we'll start.
Yeah.
Okay, we already started getting questions right now. Does corona disease would be included in health insurance? I think, Siddharth, that's already there because you have an answer for this?
Yes, sir. Can you come again, sir?
So there's a question in the chat window which asks, does corona disease would be included in the health insurance? So COVID-19, is it included in the health insurance for people?
Mr. Kothari, this is a wonderful question. This is a simple question which has been asked by every other person. So what the government of India has decided, if the companies, if you are covered with any of the companies of health insurance, this COVID disease will be covered. You need not to take any other extra pack for the COVID, but in your same policy, this COVID will be covered.
Dr. Shantanu, you are there? Okay, so I'll start it out. Welcome everyone, all the participants on the Zoom platform and the Facebook Live and the YouTube also. We'll be starting now. This event is brought to you by Taxila Business School and BNI Jaipur. And how it works out is we'll do 15 minutes of speaking by all our expert panelists here. Dr. Sachin, Jhawar, Dr. R.K. Sharma and Mr. Siddharth Sharma. And then they'll take it forward, some question answers maybe, 2 or 3 question answers each. And then Nitin would be taking closing out on the scene. So Dr. Sachin, we'll start with you as first speaker. And then we go to Dr. R.K. Sharma, who will be speaking on the mental health and how people can be more towards better decision making and mental health. And then Siddharth will cover the insurance details and how it works out for the medical fee. So Dr. Sachin, we'll start now.
Yeah, sure, sir.
Around 12 to 15 minutes.
Yeah, 12 to 15 minutes.
Okay, so I would request all the other people to please switch off your cameras so that because it's on the Facebook and it would create some kind of technical errors. Let's give the whole view to the Dr. Sachin and then take it forward from there.
Yeah, so hi friends, imagine 2040, you just got up in the morning and you go to your washroom, you have a look at your smart mirror, you brush your teeth with your smart toothbrush, you go to the toilet, have a shower, you come out. In whatever kind of screen, whether it's a watch, virtual screen, your tab or your laptop, you go and there is a dashboard that is coming. That is the dashboard of your health that is coming. The dashboard says that your smart mirror tells you that you look a bit tired. You need to sleep for 40 minutes more. When you brushed your teeth, the cells from your saliva have been analyzed and they have detected a new gene which makes you prone to a special kind of gastric ulcer. So in 6 weeks' time, an endoscopy has been booked for you. It will be a capsule endoscopy. That capsule will come. You'll have to take it. It will be connected from Bluetooth to the doctor's chamber. And after 24 hours, we have a teleconsultation with the doctor, and the doctor will tell you what to do next. In the analysis of your urine, it was found that there are some nitrites, the biomarkers in the urine. They have found that there are some nitrites, so there is some sort of infection. So you need to drink more water and eat these vegetables. And when you took a wash, the cells that were detected from your wash, they told that your blood pressure, the level of your blood pressure medication is a bit low. So you need to up your blood pressure medication dose. Friends, this will be what the healthcare is in 2040. Now when we talk about healthcare, we talk about acute care, patients, hospitals, diagnosis, cure and rehab. When we will be talking then, we will be talking about prevention, predicting, early detection and prevention for spreading. The spectrum of how we look at healthcare will be absolutely different. It is the same as you bought a car. पहले जब गाड़ी खराब हो जाती थी हम उसको ठीक कराने के लिए लेके आते थे. अब गाड़ी का एक डैशबोर्ड है, टाइमली सर्विस होती है, and if you take your car and if there is anything wrong, you don't want it to fall sick in the middle of somewhere. The same thing that applies to your car right now will apply to your body in 20 years because we will have the tools that will help us to do that. Exactly the same. At present, we are talking about clinics, hospitals, pharmas, insurance and regulatory bodies. These are the things which are considered very important part of healthcare. Of course, doctors, and doctors will be there in future also. But what will be important in the future will be data, technology, delivery of these things, platforms which will integrate all these things, digital information. All these things, when we integrate it together, will make a very different healthcare delivery model. And this is the most important part, how it will happen. What are the things that will actually change the face of healthcare? So mankind is known to be there for the last 50,000 years. If you imagine 50,000 को आप ऊपर से देख रहे हो, so पिछले 200 सालों में कोई एक या दो ऐसी बहुत इंपॉर्टेंट चीजें हुई होंगी जो पिछले 50,000 की अगर आप देखें, अगर 50,000 साल की मैनकाइंड की एक लाइन बना दें, तो शुरुआत की एक लाइन थी जब हम 4 पैरों से 2 पैर पे खड़े हुए, फिर एक लाइन बनी है, एक डॉट बना जब हमने अनाज उगाना शुरू करा, फिर एक डॉट बना जब हमने एक जगह रहना चालू करा। सो पिछले 200 सालों में ऐसी बहुत कम चीजें हुई होंगी जिससे मतलब किसी देश का किसी नेता बदल जाना, it's not important for the history. When you look at 5,000, even the war, 47 war, 45 world war or atom bomb was not important. This is something that is so important that will happen in healthcare when from cure we are talking about prevention. So the whole paradigm will shift. और वो 50,000 की हिस्ट्री में वही चीजें इंपॉर्टेंट हैं जो पैराडाइम शिफ्ट के ऊपर फोकस करती हैं. So how it will change is robots. You will no longer have to be in the same city, same country, even same continent to treat diseases. A doctor sitting in India can treat somebody in America, and same vice versa. Drones will be there to deliver healthcare, different things, reports, bloods, everything. So you don't have to depend upon delivery mechanism for doing this. There is a very interesting technology which is called as nanotechnology. So we thought कि atom सबसे छोटा part है, जबकि nano is smaller than apple. अगर आप अगर आप गोल्ड के पार्टिकल को डिवाइड कर देते हैं तो वो रेड हो जाता है, गोल्ड का नैनो पार्टिकल रेड है. These nano particles have the potency to even hit the hardest cancer, infection and other disease cells. Immunotherapy is something जो आपकी खुद की इम्यूनिटी, आपकी बी सेल्स, टी सेल्स को इंप्रूव करके आपकी खुद की इम्यूनिटी को जो कैंसर या जो डिजीजेस हैं उनके अगेंस्ट एक्ट करने की और आपके जो डैमेज्ड ऑर्गन्स हैं उनको हील करने की शक्ति देते हैं. देयर आर मेडिकेशंस डेवलप्ड व्हिच विल बूस्ट योर इम्यूनिटी टू द लेवल not by a simple medication but boost to the level where you can actually kill diseases. Artificial intelligence will actually take over the diagnosis part, where artificial intelligence will predict what sort of problems your body will have in future in integration with genes, in integration with your environment, in integration with a lot of things that are happening to the same people like you around in the world. There will be, as I told in the bathroom scenario, there will be biomarkers for everything. For your saliva, for your voice, for your skin, for your urine, everything that is coming out, there will be a biomarker. That biomarker will be unique for you, it will be unique for a disease, and it will be very specific and sensitive in preventing what sort of diseases one will have in the future. It will also tell, with artificial intelligence, with technology integration, what sort of treatment will help you the most. With DNA integration, as a child is born or as you grow, people will be able to predict what kind of health problems you will have. So even very early in the life, you can actually work on preventing those kind of problems. So if you have a high tendency of stroke, there are these things that you have to do, these things you have to eat, these things that you have to avoid, and they will be monitored and evaluated. When we say, what will 3D printing do? So at present, there are 5 kind of joints. If there are 10 lakh joints happening in India, only 5 sizes of joints are available. Is it fair? It's not fair. Every joint is different. Every joint is unique. But the treatment is the same. 3D printing, which is almost there, will actually evaluate your joint, make a joint for you, for which you don't have to go into the factory. You don't have to wait for months, it will automatically come to you. Stem cell therapy, if you don't have pancreatic B cells, something will be taken, B cells will be made, injected, type 1 diabetes, gone. Imaging, you don't have to go to an MRI or CT scan center, you just take your mobile phone and you rub it on your abdomen or whichever part with Bluetooth, with some sort of technology, it goes, it can come back. Remote monitoring and home care, we all know diseases will be monitored from home with all the technology. Diseases that will be affected by this, asthma, diabetes, cardiac diseases, cancer. So, I am not saying these diseases will go, but vaccines will change how asthma is to be taken care of. Stem cell therapy and other things will change how diabetes will work. In cardiac prevention, even the stent, what kind of stent, where it needs to be put in, at what time, of what size, everything will be predicted, then only stents or surgery would be done. So joint replacements, I've already talked, obesity. So there will be, you can have some sort of device which will be attached, which will tell you on hourly basis how much food you've had, how many calories you have you had veggies, how much fibers, how much protein it is there, and it will be a constant companion for you in taking care that your weight is controlled according to your height, your age, your sex. Again, there will be things which will help you exercise. If you are paralyzed, the rehabilitation would be fantastic. Something which will change this world very much will be availability of organs in the form of biologically or genetically modified organs, which will actually eliminate the need of kidney or liver or other organ donation in this world. So in the end, friends, like Siddharth said, something which will change in insurance is and it will come in the next few years. If you are fitter, you will have to pay less for your insurance. So from big tobacco, big alcohol and big food, we are moving to different kind of diseases. Will the earth be free of diseases? No. There is a bacteria called as E. coli. Right now there are treatments for E. coli, but there will be some bacteria which will be like a big Yoddha in Mahabharata, where you actually cannot kill that bacteria with anything. If that bacteria comes, that bacteria will probably kill you. This is because of a lot of evaluation, lot of evolution is happening in bacteria, and this is the danger to mankind. Like coronavirus, Arctic permafrost is a virus which is living in the Arctic, in the North and the South Pole. With globalization, with global warming, all this Arctic water is actually it's flowing inside into our part of the earth, and the diseases which we have not seen in the last few millions years which will come. So the virtual reality, now when we are so much close to technology, what will technology do to us? This virtual reality will cause some mental, physical problems which we don't know yet. And when I say nanotechnology, when I say new kind of metals, there is the term called as metallosis maligna. New metals and new technology, what they will do to us. This nanotechnology, how will it affect the normal human tissues? The human body does not know. So in the end, friends, things in healthcare will change for good. There will be new challenges, and the healthcare is looking at you, the future of healthcare, to come and join healthcare and take it to new heights. Thank you very much.
Thank you, Dr. Sachin, for the wonderful session and all the details which are there. If someone have any questions, please type those questions out. So Dr. Sachin is the director for Apex Hospitals and group of hospitals. He has like 4 hospitals now.
Yeah.
Yeah. And they are treating a lot of patients on day-to-day basis. So Dr. Shantanu is now joining us. So if anyone has any questions, please go ahead. Otherwise, we'll go to the next speaker and then we can come back and revisit Dr. Sachin later. Dr. Sachin, this is Abhilash Desai. He wants to ask that it would be all allopathy or some Ayur or homeopathic also would be taking care of the future thinking.
That's a fantastic question. So I'm sure that, when I talk about all this medical technology, it's not allopathic or anything. I think whatever science is ready to be developed and whatever science is ready to be integrated with technology, I think that will grow. So allopathic, homeopathic, Ayurvedic, I think everything will grow because technology will take over all these things and integrate them. It's a question of who does it, whether we Indians take the lead or whether it's the world that will take over doing it.
And what do you think about the management of most of the health sectors towards corporate now, right? When we saw before, like 20 years from now or 30 years back, right, where doctors used to run the hospitals, and now the whole corporate structure coming in, right, with people and how the medical fields are changing out. So what do you think about the same? And then we have another question.
I think when I say corporation, what I mean by corporation is running things more efficiently. So I think when the hospitals were small, when money involved in those things were not very big, doctors were good at running. So I think corporates with their knowledge or managers with their knowledge and doctors with their scientific acumen, they should both form a team and run. Because healthcare, whatever you say, it cannot be run like any other business. The emotional quotient, empathy in healthcare is much bigger than anything else. So you have to be patient obsessed and not bottom line obsessed in healthcare. If you are patient obsessed, bottom line automatically will come.
Right. Another question is coming on the technology domination towards the hospitality sector, that how technology will dominate the hospitality sector.
Undoubtedly, technology will rule not only healthcare, but more so in healthcare, because healthcare is, very far away in technology right now. So the headroom for technology is healthcare is huge. So I think as technology has transformed a lot of other things, technology will have a very important role to play, and that was the whole premise of my talk. And I'm sure you will see huge things happening in healthcare technology.
Right. Another question is how corporate hospitals will be affordable for the common man because of the per capita income being low in India. But I think that if we see the medical facilities in India, it's like one of the cheapest across the world, right? And the healthcare system which is there, right? A doctor fees in US or in a European country or even a country like China would be like at least 3 to 4 times more than what we have in India. So what do you think?
Nothing is free in India. So if you calculate what is the cost of healthcare given by the government to a patient, there is a cost. The thing is that cost is hidden and already paid for. So in whatever PHC somebody is seeing a patient, you and I are paying for it. The issue is what is the cost of delivery of that healthcare in India, whether it's being used efficiently. So there are three things. One is you have to use healthcare efficiently. You have to use your resources efficiently. And I think Siddharth will cover in his talk, universal insurance is the way forward. And I say that focus from treating will go to preventing. So how can, if the same thing, if it's a poor man, he will not buy a Mercedes, he will buy a Hero Honda and he will take care of his family. But he has to afford a Hero Honda in whatever way or form he is. There will be ways and means whereby both people who can afford Hero Honda and people who want Mercedes will have a place.
So another question, I'll give you 3 questions which have come and then you can take them all together. Will AI replace doctors? Will the opportunity of medical insurance, medical tourism in India in the future? And what do you think of the place for acupressures, yogas and things like Suraj Yoga for prevention and cure?
So quickly, one thing, AI in healthcare will replace a lot of few things, but actually it cannot, it cannot eliminate the doctor thing. So there will be doctors who will be monitoring. So what AI will do is reduce the workload of doctors. At the same time, AI will prompt you towards the right diagnosis. So it will reduce the time load. It will obviously increase the efficiency and decrease the errors. So, Google, you type Taxila and the right spelling will come. So that is what will happen with AI in healthcare. Second thing, what he said was that yoga and everything, I think everything is complementary. So if you use, I would love that if there is a healthcare facility which uses yoga for something, allopathic for something, homeopathic for something, ayurvedic for something, not depending upon the expert available, but what is most effective in that disease. So if there is this kind of science, research and integration that is available, it will be a great help to mankind. But of course, we have to wait for these things to integrate and to happen.
Another question is about the security breach of data security breach by Indian hospital sector. I think
I tell you, don't get obsessed about data breach and data everything. All this data which you are getting and which you will be getting, it depends upon how one is using data and how. So I don't think, let us not get obsessed about data. We are not ISRO or military intelligence that our data is so important. Technology, integration, information, delivery and execution is more important. Let us not worry about data breach.
so. All going forward on this role of AI is again and again coming in questions and all like this. What we saw a few years back, around 10-15 years back, was the medical transcriptions and the doctors in European countries and US and other countries doing a lot of medical transcription work coming back to India, right? But with the voice-enabled technologies now, wherein the doctors can make easily the voice notes and record those voice notes with the AI and the working, that work has now gone away. Right.
All these things will keep on happening, and we need people like you, people who are technology friendly, to actually change the face of the healthcare world. So definitely all this will play a very important role.
So do you see any kind of new technologies or something which the business owners and the future students and other people should focus on right now to be prepared to take the opportunity?
So the very important thing is visual, vocal, medical integration. How visual, vocal, medical? Because you see, in medicine, writing all of this or filling up a lot of data and everything is very difficult. Explaining what is happening to a patient is very difficult. But it is very easy to upload a video and send, to upload a voice and send, and then get a message. So these sort of integrations are very, very important. So if you can see a patient and you can form an algorithm and see what the diagnosis is, that will be huge. So, you can't imagine a doctor in a very busy OPD actually writing all of this, waiting for the result to come. But if you can make a software or something where an assistant actually, video records what the problem is, feeds it into a computer, puts a few diagnoses and everything in the front of a doctor, these things will change. At the same time, if doctor is to ask something, if he says vocally and an answer comes, so this is something which I just haven't at the top of my head. I'm sure there are a lot of things that will change how technology integrates.
So Dr. Sachin, one last question I'll take, that is like not on the medical side, but on a general side, wherein like you being one of the best doctors in the state, and then also managing a lot of employees and giving a leadership position to your hospitals, right? One is the medical field, what you do, treating patients, taking care of the patients and all. One is on the managing side of all your employees and the leadership which you are providing to all the doctors and the staff and all the admin and other people. Right? So what is your leadership style like, and how you are able to give them the direction?
So मैं तो leadership style में रजत एक ही चीज कहता हूँ, leadership में just lead from front. जाओ नहीं चलो कहो. साथ हाथ पकड़ के लोगों का काम करो, अपने आप लोग काम करते हैं, अपने आप लीडरशिप बन जाते हैं. Inspiration is the best form of leadership. Show them and they will remember it for the lifetime. Thank you very much.
Thank you. Dr. Shantanu, please go ahead and give a thanks note. Or Nitin, you would like to do that?
Thank you, Sachin sir, for your valuable information.
Fine, Sachin sir, thank you. Please introduce the next speaker and then we'll go to the next person.
Yes, our second speaker is Dr. R.K. Sharma. He is Director of Trivanta Medical and Neuro-psychiatry Hospital and Research Center from Udaipur. He has done MD in Psychiatry from prestigious National Institute of Mental Health and Neurosciences, that is NIMHANS, Bangalore, and DPM from Central Institute of Psychiatry, Ranchi. Since then, he has served in All India Institute of Medical Sciences, AIIMS, Jaipur, and Institute of Human Behavior and Allied Sciences in New Delhi. He is co-investigator of National Mental Health Survey 2015 and 16 in Chhattisgarh state, which is the largest mental health survey of India till date. He is member of various organizations, including online mental health services and support program during COVID-19 pandemic by Indian Psychiatric Society. Please help me welcome Dr. R.K. Sharma.
Good morning, Dr. Sharma. You are there? We'll
Yes,
start.
Yeah,
so we'll do the same format with you, around 10 minutes of your speaking out, 10 to 12 minutes of speaking, and then
Yes,
some
sir.
questions.
Yeah, first thing is thanks. I would like to thank to Dr. Shantanu and yourself and for this opportunity which you have given to me. And yes, I am really impressed with Dr. Sachin's presentation and a lot of things he has discussed and told. I would like to share my screen actually, my presentation.
We'll give you a code. I am not able to do that. Bhavani, please make Dr. R.K. Sharma co-host. Now you are the co-host. Please go ahead.
Yeah. So Dr. Sachin really has talked about a lot of things, and the health as a whole, including mental health as well, addiction, and a lot of things. So my chapter is definitely mental health, and yes, while I'm talking about mental health, so it is these days everyone is knowing how much important it is. So yes, stress is increasing day by day. So work stress specifically. So you can see here these are some papers, and researches has been done on mental health and work stress. So mental health problems are prevalent in all working population around the world. Yes, mental problems amongst working populations are also very costly to the society, families, individuals, health system, and employees. And psychosocial work environment. Yes, and stress-related disorders. These are really related. So how the work environment is there, depending on that stress-related disorders. So to begin with, first of all, exactly the health which Dr. Sachin was talking about. Health is a state of complete physical, mental, and social well-being, and it's not just merely an absence of disease or infirmity. It means it incorporates the word mental as well with physical health. So, but generally we are not able to focus more on mental part, and we are generally focusing more on physical part. So we ignore it. We are not able to understand. So mental health definition as per WHO, I am not going in detail in that. So I'm just talking very simplified definition. How people think, feel, and behave. That is important. So it's not just absence of mental disorder. So mental health is beyond that. Just coming to the topic stress. We are these days we are talking about stress. What is stress exactly? So stress, first we have to understand why we are having more stress. Prefrontal cortex, which is the largest part of brain in all animal kingdom, in us actually, in human being. So we have the largest prefrontal cortex, and the prefrontal cortex specifically, helping in thinking, cognition, planning, a lot of things. So we have more capabilities in planning and thinking, and other abilities which we can plan. So this is the reason we have more chances to go into stress. Yes, exactly. What is stress? Stress is the response of mind and body to a real or imagined threat. So it's beyond an actual threat. So it depends on person to person. For example, a same working condition and one person is suffering, one person is not suffering. For example, this is an example which is given everywhere. A spider is there, or any particular object is there, and one person react to it very nicely, happily, not having any fear and not having any stress. Other person is having, the spider is there in my home. What will happen? Spider will bite in the night and a lot of things. So that thought process, goes on. So this is actually stress. How one person behave differently, how other person behave differently. So similarly, this kind of thing is happening with coronavirus. Yes, we know disease is there. Yes, we know a lot of things are there, deaths are there, a lot of things. But 50% public, they are significantly affected. They have panic attacks, they have a lot of things. So general stress is there, which everyone is having. Yes, it is important. I also had stress today because I had to present this, so I had to prepare it. So this is also stress. But when this stress is, which is really motivating, we call it use stress. But when it is going beyond it, piles up, piling up day by day, and increases with time. So it starts deteriorating health, performance, relationship. We call it cumulative stress. So now it is a problem. So what causes stress? Yes, this is a report. 72% Americans who reported feeling stressed about money at least some of the time during the past month. Yes, we have this situation at this point of time because economic crisis is there. We know. So this is definitely a big factor. The parents of social media. Yes, we are seeing a lot of news in that we don't know what is the reliability and what is going on. So this is a significant stressor these days. Yes, other stressors are interpersonal disputes at workplace, at home, a lot of places, chasing the losses which already happened or which are going to happen. So monetary, familiar, personal, chronic diseases, like Sir was talking about diseases, health, and so these are also part of stress. Then there is general adaptation syndrome, means that mind and body actually in the beginning adapt to that stress. So how? Initially there is alarm reaction. Yes, our mind fight or flight to that particular stressor. Then there is stage of adaptation. It means that work is increasing. We are able to adapt to an extent. But after that, there is stage of exhaustion. Now the problem starts. Leads to stress-related disorder if it is not handled properly on time, which is generally not happening because we have significant stigma related to mental health professionals or mental health profession. So when protective and restorative process is disturbed, yes, now the problem started. So it can lead to over a period of time anxiety, a feeling of apprehension, persistent feeling of apprehension, irritability, trouble concentrating, muscle pain, tension, headaches, body aches, a lot of things. And later on, if it is not handled at that point of time, chances are very high it can lead to depression. Means low mood, not enjoying the things, feeling, it's better to die. A lot of things are there. And what is happening if you see, we are handling our stress with substance. You can see people who are smoking, and if you ask, मैं बहुत stress में हूँ, just that's why I'm handling my stress. शाम होते होते 10 से 12 cigarette or 1 packet, 2 packet, and this way. So what is happening actually? Why it is later on converted into addiction? Initially we take it to handle our stress, and then later on, this start controlling our brain. So now larger amounts are required. Started with one pack, then 2 pack, 3 packs. Started with 1 stick, 2 stick, and then 1 packet of cigarette, and then it goes on. So larger amount is required because our brain is now adapted to that. Now day and night, yes. Neglect of all other duties and pleasure, yes. This is most important is addiction now, and craving, significant craving, and then physical problems start and mental problems start. So this is about addiction. This we deal our stress by ourselves, and then these days addiction to technology, a new age epidemic. Yes, it's there. This is in text. We have this kind of addiction, and we are treating. Other impacts of stress, couple issues, domestic violence. This is increased significantly these days. Interpersonal disputes, and at last, who is most suffer? The most innocent person, child. So children mental health is significantly affected, up to 30 to 40%, and we recently started a program on that. As per my knowledge, it's a unique kind in the country. I will talk about it briefly in the letter. And if not intervened timely, there can be varied outcomes. So now we are knowing all these things, what is going on, copycat phenomena. One person is doing that, and the other person is doing that, and a lot of things are happening. So suicide is the second leading cause of death among young population. So after accident, so you can see how much important it is. And most of suicide, yes, definitely because of mental health issues. Every 40 seconds, someone loses their life, as per WHO. So we can calculate in our country as well, because we are every sixth person is Indian. So we can understand it from that calculation. Now, these are the figures which I talked about. How to identify now? We are going into stress when we need help. Yes. When sleep disturbance starts, insomnia or hypersomnia, when there is no eating or excessive eating lead to obesity. Everyone knows stress leads to obesity. And fatigue. The earlier person was able to work for hours. Now he's not able to concentrate more than an hour. Aches and pains, sweating, trembling, palpitations, and personal. Many times it happened, and immediately landing up with emergencies, like something is going to happen. So that is panic attack. Infections, if this persists, yes, the body, immunity is going down. So that is important. And if you ask about cognitive symptoms, poor decision making, memory lapses, low mood, irritability, changes in mood, and this happened with in Corona time as well. Psychological impact, almost 50%. A lot of suicides as well happened because of that. So this is a video. I'm just showing how classical panic attack is increasing, is happening. This is a video shot in Mumbai. This gentleman, you can see here, this was just, having choking sensation. So it's like, you can see here, he's calling for help. He's having choking sensation, sudden breathlessness. Something is going to happen. So these kind of things sometimes happen suddenly, waking up in the morning. And but what is happening at all? We know these symptoms are there. We know, because person who is, facing these things, we know that knows very well, but stigma, significant stigma with mental health. And despite knowing the fact, we are stigmatized. That's the reason we are gradually becoming most depressed country in the world. Society is increasing day by day. Treatment gap is almost 85% to 90%. It means that out of 10, only 1% is seeking help. This is significant treatment gap. That is from National Mental Health Survey. So 2016. Come to how handle that, handling work stress or handling general stress. So it's not possible for me to go in detail. So briefly, I'm talking about it. Stress management. Yes, there are two ways. One thing is changing one's reaction, how I am reacting to the situation. Another one is how I can change my source, how I can change the job, or a lot of things. So, but the first one, changing one's reaction, is more feasible. Changing the source is not feasible at all. So, very important thing, just identify what is going in my mind. Why I'm not sleeping? What thoughts are going on? Sit down and identify at particular time. After identification, one person will know actually that is thought, because of that I'm irritable, and because of that I'm acting very in a different way. So if I'm able to identify my thought, I can change my thinking by challenging it. I will tell you later on. And then if I can change my thinking, I can change my behavior and change my lifestyle. So this is the way, changing one's reaction. So controlling unhealthy thoughts. So in particular situation, what kind of thoughts are coming, then feelings and actions. So this is very important chart. This one can identify through this chart in particular situation, what is my mood and what exactly thoughts are coming, and then trying to question that, why these thoughts are there. So trying to find out a rational response. So just think it. So this thought record will really help. If we are able to identify, at least 50% problem is solved. So these are examples. Mind shift, lockdown to open mind. I'm stuck at home. One mindset. Okay, open-minded solution. I'm safe at home. I'm spending more time with my family. So it's it depends on person, or it depends on one thinking, how one can change thinking. I will run out of money. Yes, definitely. No one can change the reality, but we can think in other ways as well. Income reduced, but expenses also reduced. How much one needs to live. I will get ill and die because of Corona. Chances of getting ill is there, yes, but it is less if I will take precaution. Recovery is good with proper management. So these are, how we can challenge our thoughts. So other than that, acknowledge feelings shared. We generally don't share. Don't share to even our family members or near dear ones. So this is very important. Just share. Changing one's lifestyle, diet, stop addiction, exercise, sleep, relaxation. So balanced diet is important, exercise is important, relaxation techniques are important. Just deep breathing. Even though 5 to 10 minutes, deep breathing is sufficient. Even though 2 minutes is sufficient. Mindfulness, this is a very important technique. I'm not able to discuss this because this needs time. It needs, it's an art which one has to learn. But simply non-judgmental awareness of senses, including mood and thought. We generally judge our thoughts. So if we are able to understand this, we are able to control this, or we are able to reach to this stage, non-judgmental stage, more help will be there. Animal-assisted therapy, yes. Laughter therapy, yes. Spending time with family, creative solutions, yes. Coping with stress. just write down. Just write down, list the stresses in your life, write possible solutions and ways to ease stress for each of those stresses. Set realistic expectations, which we can do, which I can do, which can be possible. Come out of stigma. Let's talk. This theory is going on these days. What is let's talk? We have to talk about mental health these days. This is let's talk. And if strategies for coping is not working, then immediately seek professional help. We can prevent later on, coming anxiety or depression that will be more problematic, and then come out of stigma. Now, I can say, this question, I think it's valid now. Can work make you mentally ill? You are in better position to judge. So this, again, it's a big chapter. We have to discuss how working environment, how, employer and employee relationship, a lot of things are there. That's a big chapter. Briefly about my services, as I was telling about awareness programs we are doing. Yes, work stress, as I am part of industrial mental health in BNI. So work stress, we are working on this. A lot of industries in Hindustan, Jain, UCC, and a lot of other industries. Educational mental health, this is another chapter we are doing. So the schools, that's really need. IIT Kharagpur, other colleges in Jammu and Kashmir and other places. And this program we recently started. As per my knowledge, this unique program at this level, community level. So this is on Instagram. We are doing every Saturday 8 p.m. So to talk about parenting, because this is the actually generator of later on problems. If we can handle it, we can prevent a lot of things. But these days, a lot of things are there. Working parents, separated families. So we need this program. This is highly needed. This kind of program is generally a foreign concept, but we are implementing it in national institutes. It's going on, but I started it in general public, so free of cost. People can join us, and this is you can reach to me. So thank you so much. Yes, sir.
Yes, I think I lost my audio. Yeah. So if any questions are there for Dr. R. Krishnan, please go ahead and type your question. So Dr. Sharma, we are seeing a lot of employees working from home, right? So how they can keep their mental balance check and how they can be more productive. So if you have any...
Yeah, briefly, I can tell, whatever the condition is, most important is balancing lifestyle. So, the lifestyle which was going on and which is going on now, we have to, balance that regular exercises, dietary habits, spending time with family. That is very, very important. So we have to understand till when we are able to work, till when we are able to stretch. There are a lot of demands from the industry or a lot of demands from the, society, but where is my capacity? That I have to identify. So then only I'm able to work productively. Yes, if I'm able to think about it, I'm able to balance my lifestyle, then I think I'm able to work productively as well. Because it's, stress is going on and it's contagious. Although it is non-communicable disease, but still it is most contagious. Like you are seeing copycat phenomena, one suicide and second suicide, a lot of things. So preventing stress is more important.
So do you have any suggestion for addiction towards technology and towards this social media and something like that, and how people can be more productive in that?
Yeah, so very important thing. Other than work, I would say the social media to be kept very minimal. So it is human mind's tendency. If my phone is there, I'm again and again, peeking into that. I'm again and again trying to see that. So better use. One has to decide time limit. Okay, 1 hour I will see. And there are a lot of social media news and a lot of things are there. Why there is need to see them? We know a lot of things. So again and again seeing will not change the scenario. And more important, when one is going to sleep, at least 1 hour before, screen time should be stopped. So screen time should be cut down and screen completely stopped. So it will not hamper sleep, and then this cycle, then sleep is not there, and then again the next day fatigue, and this cycle will break. So this we call it sleep hygiene. So this is very important reason. These days you can see people who are sleeping. Most of people they sleep with their phone, and when they are not getting sleep, they again see the phone. Okay, they see their Facebook, or they see their WhatsApp, whatever. So this to be stopped. The phone, this can be kept away from the bed.
Like, and a lot of research which is being published in India and across the world on the same, that screen time of students and general people for 6 to 8 hours a day, right, which is at a very extreme level, like 6 hours of or 8 hours of cell phone usage, right? How do you think that this should be, like, this should be treated by a professional, or like what should be the step for the people to do this?
Yeah, if you ask me, I would say, sir, I'm also using my cell phone a lot because I have to work on this. But one thing is very clear: where I have to use my work related, it is understandable. But that also I have to, keep it minimum. Means the urgency and which is what is urgent, I have to to focus on that. But yes, definitely other things, then I have to keep away from it, like Facebook specifically, or the Twitter or other things. Once a while or once a day, or if one sees once in 2-3 days, does not matter. We can get the all news. But other than work, I would say it's very minimal use of mobile, specifically which I am seeing these days, the use of mobile in children. Why it is needed? Why it is needed in 14-year-old boy? Why it is needed in 6-year-old boy? And specifically very young children, what parents do, they just give the phone because to get rid of their own things, how to feed them. So that's very easy process, but overall we are hampering their curiosity, we are hampering their development. So later on it will rebound back to us.
Right. Thank you, Dr. Sharma, for all the input which have come out on this. We have one last question. What is the warning signs of stress? And then Nitin sir, please go and do a thanks note.
Yeah. So most important, if one is having difficulty in sleep, why one is not sleepy, or then followed by difficulty in appetite, either it is decreased or it is increased. So when one sees why he is not getting sleep, there must be something going in mind. So continuous thoughts are there, so one has to focus on that. Just focus on what is going in my mind, why I am not getting sleep. This is more than sufficient. Other than that, there are other symptoms like sudden panic attacks, sudden fearfulness, fear of talking to others, fear of going out. So these are also some signs. Fatigue, I'm not feeling energetic, because this is cycle. I'm not getting sleep, and then again the morning I'm waking up with fatigue, and then again I'm not getting sleep, and the thoughts are going on. So this cycle goes on. So we have to understand our own cycle, what is going on. So to understand it, more important.
Right. Thank you, Dr. Sharma, for the input. Sir, please give a thanks note. You are giving a thanks note for?
Sir, I am doing that.
Yeah,
Thank you, Dr. R.K. Sharma, for a wonderful session. Mental health is the need of the hour, and you have explained it very well. Now we would like to welcome our third speaker of the day, Mr. Siddharth Sharma, a well-known name in the field of insurance, health insurance. He is born and brought up in Jaipur and did MBA from Narsi Monji, Mumbai, and LLB from Rajasthan University. He is into this field for over 13 years now, with more than 2,500 happy clients. His forte is general and medical insurance, and he believes in transparency with the client and the insurance company. He is a social activist too, and associated with many organizations who are working for betterment of the mankind. He himself is a regular blood and plasma donor and tries to encourage people to return their part of duties to the society in many forms. Let me welcome Mr. Siddharth Sharma.
Good morning, friends. So it's a pleasure to be here and serve you guys on this digital platform. I would like to thank Mr. Bora sir for giving me this opportunity and sharing with Dr. Sachin, Jhawar and Sharma sir. So guys,
we are talking to cover on the health insurance, and yes, specifically also on why, because a lot of people, when they think of career in insurance, they go away from it, right? But it's a very lucrative and very profitable business venture also, right? So if we can focus on that also, we have around 12 to 15 minutes of your speaking time.
Yes, sir.
Right, thank you.
So may I?
Yeah, please go ahead.
So guys, I am into insurance sector and I cover people for their health insurance. So firstly, I would like to tell you about what insurance is exactly. Normally, people have this thing that if we have given a premium, we have to get it back. So what's the use if we are paying 10, 15, 20,000? So I would clear this myth that insurance is not something to take back. Insurance is to serve you, to make you in peace, to settle your claims in any mishappenings. So it's for about lifestyle, and insurance is like a society. Like in society, the people are there who help you in your bad times. So if you see, there's a group of 100 people who make a fund, they give their premium, and if someone in that group is needed for the money, they can be settled for that. So this is the main concept of the insurance. This is for the society only. Okay. So insurance is a vast field. So what we'll be covering today is why insurance is needed to us, what type of insurance are available in India, and how we can get better services at the time of claim. And then we'll take up the questions, because it will be an interactive session. It will be good if I interact with you and know your questions in a better way. So first, why insurance is needed? Insurance is needed for your financial securities. The financial security is a topmost priority in the current scenario. The hospitals are getting costlier. The treatment is getting costlier day by day. The way our lifestyle is changing, everybody wants the best treatment. Hospitals who are giving you the best treatment, best services also need funds for that. If they're giving you services, it's on the monetary basis. If you're going to the hospital and looking at the special ward, the ward which is just dedicated to you, they'll be charging you for that. So for that, you will be needing an insurance for your financial security needs. For your tax benefits, Government of India has already given many tax benefits on the mediclaims, the health insurance, because they want you to get covered. The awareness has been spread so that if in case by that people can take insurance, they are giving the tax benefits on that also. Third and most important is tension-free life. What Dr. Sharma just said is, the tension is the root cause of any disease or any problem. Tension is over there in everybody's life. So if we can get our insurance and get tension-free by taking insurance for us and for our family, and on some extent to our employees also, so it will reduce your tension and stress. And in the longer run, you will be benefited by that. Covering existing disorders. So this is the main point what many people over here might be asking in the question round, that if we are a blood pressure, if we have a blood pressure, if we have a hypertension, if we have a diabetes, if we have any cardiac issues, can we covered? Can it be covered? Yes, of course, it can be covered by a small loadings, or it can be covered if you are taking a policy in a longer run. They can be covered after 3 years or 5 years when you have taken the policies. So it's a myth that the things, whatever the diseases you are carrying will not be covered. It will be covered on a certain time. It depends on the company and the policy what you have taken. The company are encouraging people to take insurance policies and putting up the bonuses also. Suppose if you don't take the claim in the first year, you get a bonus. If your sum insured is 5 lakhs or 10 lakhs, if you don't take a claim, it can be increased to 5,50,000, or it can be increased to 6 lakhs by the company only, because they're saving on your money. So the benefit has been given to the insured that they take claims only at the time when it's very well needed. You see, we are in the scenario, India is in the young population. So everybody is want to be very secure, and they take their retirement plans also. So insurance is also for their retirement plans. If you're taking an insurance, it might secure your retired age. Now the companies are putting up with the no waiting period also. Like there was one person, Mr. Kothari, asked me in the networking session that COVID is covered in the insurance or not. So yes, the IRDA has directed all the health insured companies that COVID will be covered from the right first day. All the people who have taken the insurance, the COVID will be covered. There are many policies and disease customized by your health disorders, and all the diseases are covered right from the beginning. Suppose somebody has the diabetes issues or the cardiac issues, they can take the policies with the loading, and it can be covered from right the day they have paid the premium. One very important thing, what the professionals ask me, that we have already been covered with the employer. Do we need to take insurance? So I would like to clear over here. You are doing the job today, but security is not for tomorrow. If you leave the job or your company relieves you from the job, the insurance will also be relieved. At the time of age of 50 or 60, if you have been retired from the company, you have to take the fresh insurance, and all the existing disease won't be covered. Sometimes you have to pay extra. So my suggestions to all of you is this: if you're covered with the employer policy also, you take a slight amount of insurance on your individual also. It may give you a tax benefit also, and it will give you a more satisfaction and a coverage when the time of claim. See, medical treatment is getting costly day by day, and we are getting a better services. I would seriously tell you, the services what we were having 15 years back or 10 years back in the hospitals, especially in Jaipur or any other A-class cities, it has been improved in a lot of ways. We are seeing the corporate culture in the hospitals. For that corporate culture, the hospitals has to spend money, and the treatment cost will be heavier, and the technology part, what Dr. Sachin has said in his presentation, is getting day by day, increasing day by day. The technology will be there, the cost will be increased, and you have to shed your money into that. So for that, you have to take an insurance policy to be in a stress-free life. See, we people are kind of independent. Now, in the current scenario, no parents want to get dependent on their children. No children want to get dependent on their parents. And we don't want, in the hard times, our family or our friends have to help us around for their medical needs or for the monetary purposes. So it's always better to be self-independent and take a policies and secure you and your family, at least in the suffering times. Policies are not that tricky thing. You can go online, you can check on the companies, you can see the cashless status, you can talk to your consultant, whatever the agents you are having, you can talk to them, discuss about the best policies suiting to your lifestyle. You can take it. It's not a very risky affair, not a very time-taking affair. It's just a 15-minute start in a year to review your policy and get the best out of it. And now the companies, as we see, the long 15 years back, there were only 4 companies, the government companies like National, Oriental, New India Insurance, and United India Insurance were there. So now the private players are also in the market. They are in the competitive schemes, and they know how to tackle the customers, consumers, giving the best services, the best claim services. They have taken the third-party administrators also for that, just to make customers satisfied for what we should say, seamless transactions. No stress, nothing. You go to the hospital, you give a copy to your policy, you inform to your insurer that I am getting admitted over here, and you'll get all done. And in the last, it's a fund investment sort of thing. You get invested in your insurance policies and the tax benefits are there. So these are few things why you want to take an insurance policy. These are the things, and I believe everybody should be covered. Unfortunately, we have a less of awareness in India. If you compare from Europe or US, they are much more aware about the insurances. So if I tell you the data, the current data, only 32% of urban population is covered in the health scheme in the individuals. There are people who are covered in the workman policies, the insured employed policies, but very few are covered the individuals. So the awareness is still on a very low scale. There are many types of insurance. If you have talked to your consultant also, they would have told you there are individual policies which you can take for yourself only. There are family floaters, like individual policies like that. You have taken 5 lakh for yourself, 5 lakh for your wife, 2.5 lakh for your kids, and like that. If there is a floater policies also in the market, you can take 10 lakhs for a group. For your whole family, you can take 10 lakhs of policy, and it can be divided to your family, like your wife and kids. And there are new schemes coming into the market, which tells you about the top-up plans. Like you take 10 lakh policies for your family, and you top up with that for the 15 lakhs. So what is the difference between an insured policy and a top-up policy is like that? If suppose I tell you in your age and your health disorders, if you're taking a 10 lakhs floater policy, it might charge you for 15,000 bucks. And in a top-up plan of 20 lakhs, they'll charge you just 5,000 rupees. So what the company says are this: if you consume your 10 lakh of rupees, and then also if you need some other amount, then this top-up balance will be taken off from that. So that's a very small amount. You talk to your consultant and agent, and they'll give you a better deal on that. There are senior citizen plans also. The insured amount is very less, but it's nothing less when you are in a need. So you can go for that also. The critical illness plans over there, like the critical diseases, like the cancer or few diseases, the mental disorders also, the tumors also. You can take the critical illness policy on a top-up of your insurance policy. This is very useful policy. Do talk to your consultant for that. And there is a personal accident policy, which is very well needed. We are on roads today. We are moving here and there. the medical policy covers when you are hospitalized for more than 24 hours. So these things are covered, but the personal accident policy covers you when you are at your home also, when you're at workplace, when you're going somewhere, the accident happened, either you slip from the stairs also, something mishappening or the accident happened, it covers your personal accident. It's a very nominal price, I tell you. If I'm not wrong, it will charge you only 114 rupees for a lakh for the personal accident for a year. And they give you compensations for the salary also. If you're salaried and if your employer is cutting down on your salary, you can take this policy and the insurance company will reimburse your salary also on a certain amount. Then there's a group insurance policies which a corporate takes. The corporate is taken somewhat around employees who have more than 50 or 100 employees. The companies are giving the bulk policy, the corporate insurance policy, in which all the diseases are covered right from the day. So these are few policies which are here in the country. Then you see there are many things. There are myths about the insurance policies. People have a myth that we are young, we are healthy, we jog an hour a day, we do exercise in a gym. Why we need an insurance policy? Why we need a health insurance policy? It's not needed. So guys, I like to tell you, we all need to be insured because the hard time doesn't come with the information. It always comes without knowing you. Any midnight you can have a cardiac arrest. You're walking on the road, anytime you can have an accident. Why you take an insurance for the car? Because to prevent yourself from the further damages. Your body is much more precious than all these things. So my personal advice with you all, never go in a myth that you are young and healthy. You never know what's going into your body. It might sound very depressing, but this is the need of our hour. I tell you, you need insurance, even if you are an age of 5 years also. We have seen the people, the kids, the children in the age of 2 years getting the cardiac treatments and the very costly cardiac treatments. So guys, always get insured for your peace of mind. Secondly, there's a myth that if I have paid a check, if I have paid a cash, you need your insurance policies covered from the day. No guys, it's not covered from day. You have to check with the consultant. It will take time for that to get it covered. You need to check that it is covered from a day or a week or from the coming year. Cheap is always best. What we think, we compare, we see, it's not like a veggies. That here it is 10 rupees kg, there it is 8 rupees kg, we should go for that. You should always ask a consultant and agent, what are the benefits in the insurance policy, how it is benefited to my lifestyle, and which policy suits my lifestyle. If you are, what Sachin sir said, if you have heard him, that if your lifestyle is to move into Mercedes, you have to cover you accordingly. If you are moving on the Hero Honda, you need to cover accordingly. So if you want privileged services, you have to take an insurance plan according to your lifestyle. And if you are in the not very much affording, at least cover that much amount that you can help you in the sufferings. Buying health insurance is not a risky affair. It's a safe affair if you go it directly. It's a safe thing. So these are the things, these are the myths what people carry in a day-to-day life. The last topic which I'll be covering today, Rajasthan, I'll be taking just 2 minutes more for this, which is very important. Is this. Whenever you're getting insured, the foremost thing is to check your sum insured. You might be having a very healthy lifestyle. You might be very fleshy lifestyle. You might not be having any disorders, but you have to check on insurance that you need a sum insured of 5 lakhs, 15 lakhs, 20 lakhs, or 50 lakhs. There are the policies in the current scenario. The people are taking policies in which they can get treatment abroad also. Many of my clients have taken that policies that if any case, the treatment is not in India and we are not satisfied with the treatment in Jaipur or in AIIMS or in Bombay, can we go to Singapore? Can it be covered? Yes, it is covered. It is costly, but it is covered. Even they are giving you the air ambulance facilities also in that policies. So go according to your lifestyle. Secondly, what you have to think about is whatever company policy you are taking, you check the claim settlement process. Which TP they have involved in it, what is the ratio for the claim settlement, because क्या होता है कि हम पैसे देते टाइम हमें अच्छा लगता है कि हमने 5,000 रुपए कम दिए, but the thing is this, it can impact you at the time of the claim. At the time of claim, that 5,000 can cost you for the 5 lakhs also, and insurance company can tell you that we won't cover this. We are not liable to cover this. And trust me, guys, with all due respect to the hospitals and the lawyers in the country, at the time of any mishappening, you have to pay. There will be the lawyers for the hospitals also and for the insurance companies also. But for us to get the best treatment, we have to check the claim settlement process also, which is very important. Nominee selection. Nominee selection is the most important thing. Whenever you are taking a medical policy, always emphasize to your agent and your consultant to put a nominee name, your wife, your children, and whomsoever is liable after you at the time of treatment. There should be a nominee name. One contact person should be there who can contact to the company, or the company can contact to them in the time of any mishappening. Don't defer your payments. When you give a check, try not to make it bounce. Try to make it an online digital payment. Never bounce your check for any of your insurance, because once it's bounced, company is not liable. It's your duty to pay to the company. It's not company duty to take a check from you. It's your duty that you have to pay to the company. Make sure that amount has been received by company and you have got the acknowledgement receipt. Then if you go again, always say true to the companies. Never hide your diseases. I'll give you a small instance of one of our insured. He was facing to the hypertension and a blood pressure. Dr. Sachin sir and Dr. R.K. Sharma and all the doctors over here will agree to me that we should not hide our disorders at the time of taking the policy. When you'll be in the hospital, it might that you not be conscious, but your family members will be there. If you will be asked the first question in the hospital, are you taking any medicine? And if you say, yes, I am taking a blood pressure medicine from 10 years, from 5 years, from 3 years, and you haven't declared it in your insured and the insurance policy, your claim will be void. You won't be getting any of the claim. You have to go to the legal side, and it's a time consuming and embarrassing. So never hide your diseases, always declare your diseases. It can help you in a long run. Don't lie to your doctor, don't lie to your insurance consultant, don't lie to your lawyers also, because they are the people who will be helping your life. The doctors and the insurance companies are there to help you out. Don't lie to the doctors, don't lie to the insurance people. They will be helping you in the hard time. The last and the foremost is take a sum insured which help you to get treated in the hospital you desire. If you want to take a treatment in Jaipur, according to your lifestyle, take a sum insured of 5 lakh or 10 lakh of rupees. If you are more intent to the Mumbai or Delhi or any costly hospital, take a sum insured for 15 to 20 lakh. If you want to take a treatment abroad, at least take a 50 lakhs of sum insured. This is all. I'll be ending this presentation on this. I hope it benefits to your life and future. Thank you, Raja sir. Thank you, Sachin sir, Shantanu sir, and Nitin sir for helping me out over there. Thank you so much, guys.
Nitin sir, please give a thanks note and then we'll close it out.
Thank you.
Any questions? There is a question, how to check the claims and everything, official site?
So there's a site that you can go to the Google, you can ask to the insurance consultant or the agent, they'll be helping you out for the claim status. Everything is on Google. This is on Google.
The regulatory body is IRD, right? IRD regulatory body is
IRD. You can go to IRD site also. That is much more authentic.
Okay. And is there a policy portability now in terms of one health insurance?
Policy is portable within a time frame. Before renewal for a month, you can inform and you can port your policy, whichever company you want. There is no foundation for the portability now. And all the diseases will be covering, and all the same things will be carried forward in the coming company also.
Dr. R.K. Sharma said that this mental health also included now in the health insurance.
Yes, sir. All the diseases are covered into that. It should be treated in the hospital. Everything is covered if it is treated in the hospital. If you're getting cured yourself at the home, it is not treated.
Fine. Dr. Nitin, please give a thanks note and we'll close it out.
Yeah, it's been a privilege for us that we have Dr. Sachin, Jhawar, Dr. R.K. Sharma, Mr. Siddharth Sharma is a speaker with us for the Digital Healthcare Conclave. We are very grateful for the time and the effort you took to share your thought and experience with us. And please accept our sincere appreciation and thanks of the outstanding presentation you all had made on behalf of the whole BNI Jaipur North and the Taxila Business School. As Dr. R.K. Sharma said, calm mind brings inner strength and self-confidence. So that's very important for a good health. And if you are good at health, you are happy. So it's our duty to keep ourselves in good health. So we have to be physically as well as mentally healthy. So this is not the end of the day, but this is the starting. So we have different sessions are coming line up in the future. And this is just the starting of this digital health conclave. And I sincerely thank Mr. Rajat for starting these things. And we are looking for more future topics and other things going to have. Thanks to Dr. Mr.
Thank you, Dr. Nitin. One last input from every speaker. So maybe one last closing line by everyone, and then we'll close it out. And this will be a regular feature in the health conclaves, and we'll be focusing on health and different kind of workings on this. So we'll go reverse now. Siddharth sir, we'll start with you. Right, one book you are reading and one final advice or suggestion you have for the people to be healthy. And then we'll go to Dr. R.K. Sharma and then Dr. Sachin and close out this.
So the foremost thing is stay healthy, stay safe, and always be precautionate about the mishappening. Be insured and get regular checkups done.
Okay, and what book you are reading right now?
Sir, I'm not into books actually. I'm extremely sorry for that. I'm not into books.
Okay, we'll go to Dr. Sharma. Please go ahead. Dr. R.K. Sharma. I think I need to unmute him.
Yes, sir. Yeah, I think I would say,
Yes.
As per my, my stream, I'm telling, actually health is important, and it's including all health, including physical health, mental health, and social health. So from where I'm saying it's from definition of health from WHO. So all are important. Yes, diseases are important, but not only treatment, but preventive aspect is also important. So I think this program which is conducted today, these kind of programs are necessity of time. These are really need of time. So this should be conducted on regular basis, I think.
Thank you, Dr. Sachin. You need to unmute yourself. Yes.
So, two important things. So, the book I am reading is 7 Habits of Highly Effective People, Stephen Covey की. मतलब शानदार किताब है और बहुत सारी समरीज और बहुत सारी ऑडियो बुक्स आपको मिलते हैं. I think there is nothing like reading books in this world. The second thing is कि बहुत सारी बातें होती हैं, माइंड, बॉडी, सोल, पॉजिटिविटी, whatever. पर आपको बताऊं कि कहीं ना कहीं से शुरुआत करनी पड़ती है और बेस्ट चीज उसकी शुरुआत करना किसी ना किसी फॉर्म की एक्सरसाइज करना है. जब आपका शरीर एक्सरसाइज करता है ना तो दिमाग और दिल अपने आप ठीक हो जाता है. बिलीव मी, दिस इज अ फैक्ट एंड दिस इज द ओनली थिंग दैट इज देयर इन आवर हैंड्स. थैंक यू.
Thank you, Dr. Sachin. Shantanu sir and Nitin sir, thank you for the wonderful session which you have organized and got us all the speakers and all. We look forward for the next one session in the month of July with another expert panel from you.
Yes, sir, surely. So we are in this.
Thank you for joining. Yes, sir. Please go ahead and
thank
speak.
you. And my one take for today is, as my profession, I'm a physiotherapist, and I just want to say, just keep healthy. Have a habit of doing any one physical activity a day, anything whichever you want. Just be healthy, be safe, be mentally and physically, just be safe. And one book I am reading right now is what is the effect of pain on the mental health. That is what I'm reading right now.
Thank you everyone for joining. We'll close now. Shantanu sir, you want to speak? Otherwise we'll close. You want to speak something? Fine.
Thank you everyone, sir.
Fine, we'll be closing now. Thank you for joining.
Thank you.